We continue to celebrate Hispanic Heritage Month here at KTXS, and today we take a deeper look into mental health within the Latino community. Thank you so much for being with us this morning. We're very excited to have you here.
Thank you.
And so we'll just get right into it. And can you just kind of tell me a little bit about how mental health looks like just in a general sense within the Latino community?
So as of 2022, since that's our most recent research, the Center for Disease and Prevention has reported that 49,000 deaths occurred that year. And out of those 49,000, about 5,000 of those were Hispanic and Latino people.
And so there's always this like stigma that getting help for mental health, at least me growing up in the Hispanic culture, is sometimes we're scared to reach out for that help because there's this negative stigma that it's bad. You know, mental health sometimes for other families it doesn't even exist. So how does one who's, you know, growing up and trying to break that stigma go about that?
Well, trauma wants to stay hidden. There is usually shame and guilt around it, and reaching out to services is difficult in the United States because there is a cultural and linguistic barrier that the United States has done a great job in trying to overcome and make sure that there is access in their language and that is accessible, affordable, and within their communities, or electronically, especially after COVID. Now we have that access, but the stigma just comes from somebody breaking that chain, whether it be the caregiver, whether it be the child, whether it be through the school system, but just knowing that help does exist and it is out there and it helps stop the cycle from repeating.
And so if you could just touch a little bit about how that treatment looks like, how does our culture influence or affect the type of treatment that we should be getting individually?
Well, the treatment itself, counseling, looks very similar. The things that would change would be obviously the language. If we can get it in your first language, that is helpful. If you can get a therapist that is also aware if you are a first generation, if there's acculturation, and those things, that helps.
And so when looking for a therapist or a counselor, what are some things that, you know, somebody who comes from a family who sees mental health as something negative, as something non-existent, what should that person who's trying to break that cycle really look for in somebody who they want to get help from?
Understanding, patience, reassurance, and commitment to that cycle of hesitance. Of I do want to be better, I want support, but at the end of the day, this is something that my family might not understand or support me through.
And how would you advise somebody to go about that, to, you know, really try and break that cycle that you were talking about earlier, but they just really have no support kind of all around?
I would say just being consistent, because there is no easy way to go about it. Breaking trauma bonds, breaking trauma chains, breaking the cycle is challenging. Even if you do have a family that is supportive, doing the hard work yourself is challenging, because even if somebody wants growth and better for you, you have to do the hard work.
And what would be kind of a piece of advice for anybody who's at home, who's watching, who's, you know, surrounded by this this kind of stigma of, you know, it's not something that you should really worry about, but even though they do identify that they need help, kind of what would be your piece of advice for them to be able to take that first step?
Oh, that's a challenging question. I would say stick it out. I went to school to become a counselor, and my family kept asking, so when are you going to get a real job?
Wow.
And it's like, oh, well, I have real debt, and this is a real salary, and just being consistent with knowing that this is something that I wanted for me, so that when I had children, which I now do, to not pass that forward, and for them to have better, which is initially what most parents always say coming to the United States, saying, I want better for my children. And then they don't understand that that mental health piece is also for betterment. So just sticking it out with yourself if that is something that you want, that you're needing, saying, even if I don't have the support from caregivers that I would like, I can still do it and maybe find a support system from somewhere else, whether it be through school, through extensive family, through a church, anything like that.
Perfect. Well, thank you so much for being here with us this morning.